class. My name is Lunge Oluremi Oluranti. I'm going to be taking us on TAU NSC 509, Health and Nursing Informatics. Health and Nursing Informatics. By way of introduction, the learning outcomes first. At the end of the course, the students should be able to discuss the importance of computers in healthcare practice, discuss the use of electronic health records, explain the ethical boundaries in the sharing patients' information electronically, and apply health and nursing informatics in the care of the patient. By way of introduction, information science is a science and practice dealing with the effective collection, storage, retrieval, and use of information. It is a multidisciplinary science that involves aspects from computer science, cognitive science, social science, communication science, and library science to deal with obtaining, gathering, organizing, manipulating, managing, storing, retrieving, recapturing, disposing of, distributing, or broadcasting information. It is increasingly being emphasized as an important area of research in management studies and has expanded to examine the human communication, interaction, interfacing, and interaction of people, information system, and cooperation. Similarly, digital health technologies which use computing platforms, connectivity software, and sensors for health are emerging in healthcare. Global Strategy on Digital Health 2020 to 2025 by the WHO is developed to strengthen the healthcare system through the application of digital health technologies to patients, healthcare professionals, and the industry. Subsequently, nursing informatics has been developed to enhance the effectiveness of management and communication. Nurses are major stakeholders in healthcare, and based on their knowledge, they translate data to information, information to knowledge, and knowledge to wisdom. For greater achievement in nursing practice, nurses need to design and adopt innovative means to make their contribution to the patient care process and patient outcome visible. Hence, Nursing Informatics NI will bring nursing contribution to help improve the patient outcomes and make it visible. Health informatics. Health informatics, the basis for digital technologies, is the scientific discipline concerned with the cognitive information process and communication task of healthcare practice, education, and research included in information science and technology needed to support this task. It is an all-embracing, and medical and nursing informatics can be viewed as subsets. Health informatics originates from the science of medical informatics, which originated in 1974. Health informatics is the interprofessional field that studies and pursues the effective use of biomedical data, information, and knowledge for scientific inquiry, problem-solving, decision-making, motivated by effort to improve human health. It involves the practice of information processing and the engineering of information systems. The field considers the interaction between humans and information. Information has a social impact on information challenges. In other words, it is the science of information where the information is gathered as data with meaning. Nursing informatics. Nursing informatics is a specialty that integrates nursing science with multiple information science management and analytical services to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Nursing informatics enhances decision-making in all direct and indirect nursing roles through the collection, extraction, aggregation, analysis, and interpretation of roles through and interpretation of standardized data using emerging data science principles and methods. Nursing informatics is also defined as a science and practice that integrates nursing information and knowledge with information and communication technologies to enhance the health of the people, the families, and communities worldwide. This is a diagrammatic representation describing what nursing informatics entails or encompasses. Here you have nursing science, information science, computer science, all coming together to form what is called nursing informatics. The goal of nursing informatics is to improve the health of populations, communities, families, and individuals by optimizing information management and communication. It includes the design and the use of informatics solution and/or technology to support all areas of nursing. The direct provision of care, establishing effective administrative systems, designing useful decision support system, managing and delivering educational experiences, enhancing supports lifelong learning, and supporting nursing research. Use of informatics in nursing. Primarily, nursing informatics reduces medical errors, increases efficiency, improves communication loops, enhances service delivery, and promotes medical professionals' performance in all fields of medicine. It has equalized knowledge opportunities among the healthcare providers and the patients, creating an e-patient phenomenon. Nursing informatics promotes time management, time spent on patient care, documentation time, information access and quality, knowledge updating and utilization, nurse-patient relationship, the teaching of families and patients, communication and care coordination, among others. Competencies in informatics use in nursing. According to Tiger, that is Technology Informatics Guiding Education Reform, three parts were identified: basic computer competencies, information literacy, and information management, including the use of electronic health records. Electronic health records is a digital version of a patient's medical history. The electronic health records are kept in a digital file. It contains the same kinds of information as paperwork, including medical history, including demographic information and immunization records, clinical data such as vital signs and lab results, prescriptions and medication dates, images such as X-rays, MRIs, ultrasounds, and CT scan, plans of care, progress notes, and outcomes. Advantages of electronic health records. Record accessibility. That is, the records are readily available. Improved documentation. Fewer errors. Professional satisfaction. Real-time information. Care quality and safety. Then lower costs. Challenges of electronic health records: less patient contacts, inadequate training, documentation errors, interoperability. Confidentiality and security information in healthcare environment. Confidentiality is an ethical duty that prevents certain people from sharing information with third parties. Patient autonomy requires that individuals be free to choose, except in certain limited circumstances, who accesses information about their health. In order to protect patient privacy, state your name and credentials to start, confirm the patient's identity at the beginning of each appointment, ask your patient to verify personal demographic information, ensure that you and your patient are each in a private area where you can speak openly. Use headphones so others do not overhear confidential information. Avoid public Wi-Fi and use password-protected devices. Telehealth, telenursing, and telemedicine. Telehealth is a vital process in enhancing access to healthcare services, reducing or eliminating health-related travel time, linking health professionals to general population, reducing cost of health services, and solving the issue of uneven distribution of medical services to a certain extent. Telenursing is a subset of telehealth that focuses on delivery, management, and coordination of care and services using technology within the domain of nursing. Telemedicine is defined as the use of electronic information and communication technologies to provide and support healthcare when distance separates the participants. This is a type of diagrammatic representation of the increasing applications of telehealth in nursing. Here we have nursing services, nursing education, nursing administration, nursing research. Here we can see that telehealth is applied in this area, and this brings about telenursing. These are my references. Thank you for listening and thank you for being in class. I will advise that students should avail themselves the opportunity to access these resource materials as and when due, and to be conversant with content and the notes of this introductory part of this lecture. See you next time. Have a good day.